Thanks everyone for joining today. I'm really delighted to be here to talk to you about some pretty recently published work from that's a joint effort between my team at CAREX Canada and the Evict Radon National Study. So I'm going to I kind of wove together two recently published papers from our group to talk to you about today. And I know I almost always say this when I give talks, that I haven't prepared enough slides for the whole time. And I hope that I am actually correct today. I want to have time for conversations here, because I do want to say that this work is ongoing and expanding. And I'm going to share a little bit today from one of my current postdocs that I have with Dr. Erin Godarzi from Evict Radon. So that's Monica Caicedo Roa. So she has some ongoing work on the impact of the COVID-19 pandemic on people living with disability, in particular around how much time they spend at home and how that could be impacting the risk of other diseases. So I also will talk at the end, and maybe we can have a discussion about it. And you will see it in my poll questions too, that we have some planned research that is awaiting funding. We're hopeful that we'll get somewhere. We do want to start to consider the impacts of working from home on cancer risk broadly. And we mean that both in the sort of costs and benefits ways. So I now work from home 100% of the time, and I can say that that's been very good for my occupational health and safety, but I don't know if that's the case for everybody. And so we'd like to do some work on this, and I think we'll have time to talk about that at the end. I mentioned this, but I do want to just acknowledge the Evict Radon National Study, including the people noted here, especially Erin Godarzi, because I'm going to use a lot of his slides today with permission. But all of the co-authors on the paper that I'll share today, which has almost the same title as my seminar. And then I do want to acknowledge some of the folks from my CAREX team. Well, I like to acknowledge all of them all the time, but the ones that I've noted on the slide here are the ones who did the work on estimating exposure to radon in occupational settings in Canada. I don't have any conflicts of interest to report, and you can see all the different funding kind of sources for the work that I'll present today along the bottom. I know we had a land acknowledgement. I'm not joining you from those same lands, so I just wanted to take a moment to tell you that I'm joining today from my home as a white settler on the stolen lands of the Lekwungen-speaking peoples, which includes the Songhees and the Esquimalt First Nations. So these images I'm sharing here are from an art series created in 2008 here in Victoria called The Signs of Lekwungen, and it has these 7 unique site markers that designate culturally significant sites for the Songhees and Esquimalt nations that are nearby to my house. I live very close to the Inner Harbor in Victoria. And the markers, I encourage you, if you're over on the island visiting, to go and have a look at them. They're very beautiful, and they were carved by 2 Coast Salish artists and master carvers, Butch Dick and his son, Clarence Dick Jr. So I'm going to kick us off with a poll right away, and all the poll questions today are really for my, I'm just interested. So there's nothing here that's hard. There's no tests. I just want to know your opinions. So this is the question 1, asking you, what kind of a mix between in-office and at-home work do you prefer? So I've told you that I work 100% at home, which I like. But I recognize that there's lots of different opinions, and I'm very curious about folks in the occupational health community. Very cool. Most people have answered. This is great.
Yep, sure. I have stopped a poll.
Okay. Very interesting. So yeah, I'm seeing there. Can you see it, Angela? I don't know what I'm supposed to do here. Sorry. I know we ran through this.
Can you see the results that we shared?
I can see the results. Yeah. So should I just talk through them? Yeah. So it
Yeah.
looks like most people, more than half of you chose a mix of home and in office, but more days spent at home, which is kind of what I expected. That's over half, which is interesting. That's a little bit higher than I think I've seen in other polls before. There's just a couple of you who want to be in office all the time, and another handful of always at home, but really, yeah, I guess looking at the C's and D's there, that really makes up the vast majority of folks. About 80% of you want to like this hybrid mix. So I'm not surprised, and I think that we can talk about that in the discussion, because I think it does really reframe how we think about occupational health when now your home really is your work in a lot of cases. So why are we talking about radon today? We're talking about work from home as well, but we're talking about radon today. So you can see here in the top left, the age standardized mortality rates for lung cancer worldwide. And that's contrasted on the bottom right with the share of people who smoke every day. So what you might notice, and that we have circled here, is that that's quite striking, is that Canada has exceedingly high rates of lung cancer mortality in the world, but exceedingly low rates of daily smokers. So what the heck is going on here? So as you know, lung cancer has many non-tobacco causes, and indeed in Canada, about 20% or 1 in 5 new lung cancer diagnoses are now occurring among people who have never smoked. So this really is, it's not a uniquely Canadian problem, but it is a very big Canadian problem. And so I think, it speaks to how much of a priority that other non-tobacco causes of lung cancer should be addressed. There are a bunch of different causes. I'm not going to put all of them up here, but I'll summarize a couple of them. So we have air pollution, arsenic, asbestos, which we'll all know very well in this room. But radon gas is actually quite a large one, of really high importance, both in people's home settings as well as in occupational settings in Canada. So I'm sure that most of you are familiar with it. I'm not going to spend a lot of time talking about what radon is, but it is a natural decay product of uranium in rocks and soil. Canada is a very uranium-rich country, which is why it's quite a big issue here for us. And so some regions just naturally have more uranium. Why is radon important? Well, Canadians are exposed to radon mostly from their indoor air. Workplaces are a key source of exposure. But our teams at Carex and Evict Radon are really interested when these lines get blurred between workplaces and home. So radon can just get into the house through any cracks, openings, or gaps in foundation walls. And the air pressure differential between inside and outside is what drives your home to kind of suck that radon up and bring it inside, where it can concentrate to unsafe levels. So Canada, compared to the world, I know I said before, Canada's a uranium-rich country that has to be concerned about radon exposure. So this shows you the average residential radon exposures worldwide, and it splits Canada up into regions because we do have very large variability in Canada. So you can see Canada is represented there multiple times. So you can see in the prairies, the central west part of the country, we have the second highest radon levels in the world. But even where we are in BC and the Pacific, our levels are still very high on a global scale. But it's really interesting when you break Canada out into those regions to see how much of an issue this is and how regionally it varies in Canada. I will say though, just because we live in a lower area overall in Canada, in most parts of BC, not all of them, the interior of BC definitely has pockets of higher radon. There is no health region in Canada that doesn't have homes or buildings that are above the health-based limit for radon exposure. So it's not sort of a call to complacency that, well, if you live in one of these regions that are lower risk, that you don't have to worry about it, because there's always buildings that are able to sort of concentrate radon to unsafe levels. Although, keeping in mind that things do vary spatially. I'm going to talk for a minute about Carex. I know most of you know about us because we're based in SPPH, but I'm going to talk a little bit about some of our estimates of exposure to occupational radon that we developed with Carex, which at the time were very groundbreaking, and now we really need to update them again. So we can talk about that basically because of this concept of work from home. But just as a brief intro to Carex, we develop estimates of the prevalence and level of exposure to a suite of carcinogens, both in occupational and environmental settings. I'll just talk about the occupational ones today, but we do have a lot of resources for home-based exposures to radon on our website. Radon is a very high priority carcinogen kind of in our top 5 that we're concerned about in Canada as such a leading cause of lung cancer. But really what we're doing at CAREX is, in addition to creating those estimates that are really useful for research and policy and prevention, we really want to just actually reduce the risk of cancer. So the more that we can raise awareness of carcinogenic exposures occurring at work and in the environment, the more ability that we'll have to design policies and programs that can reduce this risk. And one of our the main thrusts of what we're doing is looking at marginalized populations. So different marginalized worker groups. We have a key component of our work that we're moving more into that's on environmental racism and justice. We know that environmental carcinogenic risks are concentrated among those who have other marginalized identities. And so it's really foundational to the work that we're doing, that we are trying to reduce disparities in cancer risk, which still drive quite a lot of what constitutes our full cancer risk. So I mentioned I'm going to talk about a couple of papers. This is the first one I'm going to talk about where we've published our estimates of exposure. When I say estimates, I'm just talking about the number of people exposed and their levels of exposure. This is a flowchart right out of the publication, which is published in Scientific Reports. So there's a link on there. So feel free to have a read through of it. And I'll show you a little bit from our website as well. But basically, we use a combination of radon measurement data from federal buildings. So there's some assumptions you have to make there. It's probably not representative of all workplaces, but it does have quite a few workplaces in there. So it's sort of the best that we could do at the time. And then we can look at those concentrations by province. And then we've developed a metric for probability of exposure. So you'll see some differences here in the paper. We put a threshold of 100 becquerels per cubic meter, which is the unit of measurement for indoor radon. So in the paper, we talk about people exposed above 100. On our website, we focus a little bit more on the 200 number, but it's really actually kind of interesting to look at them both. So I included them both in here because it speaks to a little bit of how where you define your levels of risk can change policy dramatically. It can actually change the size of the exposed population quite dramatically, which it absolutely does. I'll show you in a minute. So the current health-based limit from Health Canada is 200 becquerels per cubic meter. However, the WHO uses a threshold of 100, which is why we included that category of exposure. So people with exposure between 100 and 200 becquerels per cubic meter. So wherever you select that threshold really drives the number of people that you're sort of counting as exposed. So our CAREX estimates are that approximately 190,000 Canadians are occupationally exposed above 200. I'll show you in a minute when we look at above 100 because the results are quite different. There's many workers exposed between 100 and 200. But you can see here, it's kind of interesting to see a lot of our other, this kind of graphic, we have this for all of the different, 50 or so carcinogens in occupational settings that we estimate exposure for. They all kind of look like this. And sometimes you'll see things are quite driven by one or two industries. So when you look at that proportion of industry exposed, for something like silica in construction, that number is going to be quite high. For radon, because it's sort of distributed across basically anybody who works inside, it's a lot smaller pieces of the pie, but they do translate into really large groups of people exposed. And maybe our other estimates too also tend to call attention to industries that we might have considered, dirty previously. So manufacturing, construction, this is where you'll see kind of big numbers coming out. Radon's really different because even though there is a large group of workers exposed at high levels in metal or mining, people who are underground, which is very important for prevention, most of the exposure in terms of the number of people is occurring in workplace settings like we probably all work in right now, at least if you're in school or studying, where it's more of an office building where you probably wouldn't be worried about occupational cancer in general. So I think it's an important one for kind of risk communication because it kind of takes these quote unquote safe work settings of buildings, office buildings that are fairly sterile in nature, but it can have the sort of insidious exposure occurring there. So as I said, we did in the paper actually look at using that different threshold of 100, and you can see here, so we went from 190,000 workers exposed above 200. But once we include this low group between 100 and 200, our answers basically triple. So we have about 600,000 workers exposed above 100 becquerels per cubic meter, which does impart a risk of lung cancer. You know, that category of those, I guess like 400,000 or so in the low group, you can see by setting it a little lower, actually, there's a lot more people that come into that category. So it's yeah, I like this. We don't usually do this with Carex. We usually sort of base all of our thresholds for calling something high or low on occupational exposure limits. And we can't really do that for radon because frankly, the occupational exposure limits for radon are pretty bananas and so different from what the acceptable levels for indoor air in homes are. So we use those public building home-based exposure limits to estimate exposure for radon. So just to reflect on this for a minute, so we have, about 600,000 workers are occupationally exposed to radon, about 200,000 above 200 becquerels. And so while most workers are exposed at a quote unquote low level, the size of that exposed population is really concerning. That's about, for context, I think there's 17 million workers in the labor force in Canada. So it's about 4% ish if we consider that lower cutoff. So it's a pretty big chunk of our worker population has these exposures. And these estimates sort of looking at prevalence and level of exposure, they're not the first ones in the world to look at this, but other radon exposure estimates do tend to focus on workers that have direct exposure. So working with uranium, working in nuclear power plants, these kind of people who have other radon plus other radiation concerns in their jobs. So that those people tend to be quite well characterized worldwide in terms of understanding the burden of lung cancer. But our study is the first one to include workers that would traditionally be considered unexposed. So these non-industrial workers in typical office or other types of buildings. The big caveat there in my fourth bullet, though, is that we did these estimates before the start of the pandemic, and none of them include anything to do with work from home. So even though there's always been people who worked from home at least part of the time, it was relatively small before the pandemic. And honestly, we've never really considered in any of our Carex estimates to think about home-based exposures, but we are really sort of driven to do so because of the unique qualities of radon. So because of that, we've done some more work to start to think about, well, how does work from home impact people's radon levels? So this is, sorry that there's so many words in this one. This is our second poll question, but I'm really interested in this, and this speaks to that question I said from the outset, that we have a grant submitted. And I mean, there's the Cancer Prevention Research Cluster that's based with us at SPPH, led by Dr. Trevor Dummer. So we have a grant in to kind of think about these questions. So there's a lot of different cancer risk factors that could be made better or worse by working from home. And so I'm just curious what you think, just your opinion on which one has the most impact. So radon is one that I think is really important. It's probably higher for many people if they work at home. Air pollution could be better or worse depending on where you live. Maybe it's food quality and availability, fruits and vegetables. Maybe it's physical activity. I know for me, I get more physical activity now that I work from home, and probably people who had long car commutes would maybe say the same, but it could be very different for people who used to bike commute. There's also lots of research on alcohol and tobacco availability for people who are at home, so that could be riskier behaviors, and maybe it's something else. And we can, if you pick that one, then please put it in the chat, and maybe we can talk about it later. This is really good. This is interesting to see these coming in. I'm going to have to share the results here with my co-investigators on our pending grant. Awesome. So I see the poll has ended. So it looks like we have a tie between at 39% for radon exposure. So yay, we're talking about that today. Maybe that's just a confirmation bias. And then the other one that it's tied with is physical activity. I think that's really fascinating. It looks like everybody picked ones that I had. Nobody picked something else. So, okay, well, good. Our grant included all these things. So hopefully our reviewers look upon it favorably. But there could absolutely be other things. Part of the grant, if we get it, will be to do some reviews to think about all the ways that cancer risk could be raised or lowered depending on if you work from home a little bit more. So knowing that radon is important to you, it's important to me too. So we'll move into some of the more Evict Radon national study results that we have here. So radon as a health issue really depends on three factors. The location, because that's, the radon has to be there. There has to be uranium in the soil and rocks in order to create a radon issue. So the map location is really important. The built environment is really important. So what kind of a building you're in, and there's lots of different characteristics that can increase or decrease the risk of radon buildup. And then the third piece is behavior and demographics. So what people do and where they spend their time really impacts whether or not you have a radon problem. So those are kind of the three ingredients when we're considering if radon is an issue. So I've talked a little bit about this already, but radon and telecommuting is what we are discussing today. So telecommuting was already on the rise pre-pandemic. So showing there, in a Seattle study, working from home increased by 50% over the 10-year period starting in 2007. So even before the pandemic started, this was already becoming a larger and larger share of the workforce. And, still in 2017 was about 6%. But it's not trivial. And I'd like to see this repeated again and see what it is now, because I'm sure it's higher. And then from the Evict Radon national study, which I'll talk about some results, it's an ongoing citizen science-based study. You guys, if you haven't tested your radon in your home or apartment before, you can do so, and you can then participate in the Evict Radon study. So we have a cohort of people who've tested their homes for radon and shared the data with us, and we can kind of reach out to them and talk to them periodically via surveys. So it's an ongoing study where we can ask different questions of them at different time periods. So on the right panel there, I'm showing you results from the Evict Radon study. So there's a significant difference in terms of radon exposure already for those who go away to an office compared to those who work at home. And this is typically because radon, we think of it more as a home-based problem because we presume that occupational health and safety regulations for carcinogens should be controlling it better in workplaces. And we can talk about whether or not that's true. I don't know how much compliance there is with that. But in general, we did see it in our Evict Radon study that if you leave your house and go to work as part of your routines, then your radon exposures are probably lower, with some important caveats there. So the big question is for us today is, how did radon exposure change in the past few years since COVID began? So telecommuting really is our new normal. Many workers prefer working from home at least some of the time, including almost all of us in this webinar right now. And there's still a shift from pre-pandemic where hybrid arrangements were a bit more rare and where they're now really kind of the norm across a wide variety of industries. So this is really important from a risk management perspective, because the things that you're exposed to on the clock in the house are really now workplace hazards, which is fairly unprecedented from a regulations standpoint, probably of interest to many in the room. So kind of thinking about it as a risk management question, I think is really fascinating. I mean, I don't know for those of you in the room, when the pandemic started, I was working for Alberta Health Services, and the only thing I had to do in terms of setting myself up to work from home, which I had to do 100% of the time, was required. The only thing I had to do was take a picture of my desk and show it to someone with absolutely no training in ergonomics to make sure that it was ergonomically safe. So I know it is because I have enough knowledge given the training I have, but it was not very well managed. And I remember thinking about it at the time that, what, this is not the only thing we should be thinking about. And I mean, it's certainly important. Ergonomics is absolutely important, but if that's not even being really managed super well with work from home, then how are we managing all the rest of it? The changes in where we work and how much time we spend across different indoor locations has a direct effect on our exposure to radon. And these changing activity patterns have been of great interest to us at both the Evict Radon National Study and CareX Canada. So we undertook a survey of people who've participated in our citizen science project and study to get a sense of how their activity patterns changed because of the pandemic. Now, this is a pretty intense survey because we are asking people what they're doing kind of every minute of the day over the year so that we can see where they are and how that might be impacting their radon. So it's not among our full cohort, because the survey to fill out your time activity patterns is pretty time intensive, but it has been filled out by a lot of people, and enough that we can take a look at this over different periods in the pandemic. So sort of early early phases where there was a lot of non-pharmaceutical interventions, public health interventions for COVID prevention, and how that's kind of changed. And we've done this survey multiple times. We are doing it again to kind of get more of a sense of how this is shifting over time. But what this push to be working at home more, I mean, spoiler alert, it's not really gone back to pre-pandemic levels, and I don't know that it will. So that survey that I'm going to share with you in a moment was completed by 4,000 households that had about closer to 10,000 occupants in those homes. And so we were asking them these very detailed time activity pattern surveys to get a sense of how they split their time between different locations as a result of those pandemic-related public health interventions. And this paper was also recently published in Scientific Reports, and you can have a read of it there. I'm just going to touch on a few things from it. So it's a very cool paper. There's a whole section in it on how we used social media influencers to get people more interested in radon that I won't touch on today, but it's a really interesting paper that I recommend to have a read if you're interested in this topic. So the important time activity pattern information is these are the 4 domains across the top there. So we want to know how much time people are spending in their primary residence, how much time at a different residence, how about a non-residential building? So this is for most people, this is their workplace if they go to a workplace, but it could include going to stores and things like that. And then the 4th one is outdoors or in their vehicle. So long story short, and perhaps not too surprising, the amount of time spent at home has been higher since the pandemic started in 2020. It increased by about 11% in terms of the number of hours per year. So in this graph, I'll just describe it briefly. So each dot represents a person in the Evict Radon study. And if that person's above the red line, that means they spent more time at home from 2020 forward than they did before 2020. And if you're below that line, you started to spend less time at home since the pandemic started. So it's quite clear that most people in our study did start spending more time at home once the pandemic started. The people that are kind of below that line, interestingly, well, you might guess why, a lot of them are healthcare workers and other people who came out of retirement to go back to work. So, which was also kind of driven a lot by healthcare workers early in the pandemic. If you remember, lots of retired nurses came out of retirement to go back and help with the early response. You can see here the same concept. So we wanted to understand so that there's an 11% increase on average. So where did that difference come from? Well, it really looks like it came from not going into the office. So the amount of time spent in other non-residential buildings, so not our homes and not our workplaces or friends' houses, you can see that went down once the pandemic started, and all that increasing time went to time spent at home. So the yellow little piece of the pie is mostly people going to work, and you can see that yellow piece of the pie got a lot smaller after the pandemic started. In order to take this a step further, we take the amount of that time spent at home and combine it with radon levels, which we know because these people are in our study and they've measured the radon in their home. And if we have those two details, you can combine them and estimate with this fancy equation, the amount of absorbed radiation that they are potentially absorbing to their lungs each year. So knowing how much time they're at home and how much radon is in their home, we can make these kinds of estimations. So this is the same kind of graphic, but now showing you the radiation dose. So this is not the time spent at home, it's the radiation dose. So you can see the absorbed radiation dose went up actually by more than that 11%, actually closer to 20% increase in radon. So how was this the case in our study? So this is because not all Canadians experienced an equal increase. So there's people in our study who were already exposed to higher radon levels, and they were also the people who started spending more time at home. So it was kind of a double whammy for those folks, and they drive the mean exposures, up a little bit higher than even just that change in time activity patterns, because they tended to be already the people who had higher levels of radon in their homes. Just to take a moment to put those doses in context. So even pre-pandemic, which you can see is the middle of this graphic, our average radiation dose from radon in Canada is about 3 millisieverts per year, which is much higher than the global average. It's about 3 times the global average. But if you look higher up in the graph, there's many Canadians with very high radiation doses from radon. And during the pandemic, we see an increase in the annual radiation dose from about 2 to more than 40 in that one group that's like really that's in that higher category. And this is really driven by those changing time activity patterns. So for most people, radon went up a little bit, but there's a particular subgroup where it went up quite a bit. So this is a bit of a busy graphic from the paper. I'll highlight a few key things here. So we're looking at so no change in exposure is across that middle with the dotted line. You can see some people who are less exposed, the tails coming out here in terms of their radiation exposure, and then more exposed here. So again, kind of showing you similar to that dot matrix I showed you before. But there's three key things that really jump out to me here. So this is age, work, and community. So the younger you were, the more time you spent at home after the pandemic started. If you were working, your change was larger. And for community type, we saw large urban versus rural differences. So so the change was more so, it was a bigger increase for those in urban and suburban than rural locations. There's also, I didn't highlight it here, I'll talk about it on the next slide, but it's also people who have kids at home. So that's sort of, it's younger age, but it's also because those tended to be the people who had young children at home. And so in early days in Canada, when schools were closed, really, I mean, most parents at least had to be at home quite a bit more than maybe other folks who were still working in essential industries or essential commercial types of enterprises. So these are the main drivers of higher radon exposure after COVID started. So being younger, having a job, having kids at home, being in urban settings, and then having these telecommuting amenable job types. So I'll go into it in a second in terms of the job types. So we can break this pandemic related change down into these four distinct groups. I mentioned this briefly before. So there's about 7% of people in our study who started to see less exposure once the pandemic started. There's about 22% that saw no real change in their radon dose. A majority of people that I mentioned, so 57% with a modest increase in their radon dose, and a small but important group of people, which is about 15% of people in that survey, with substantially increased radon doses as a result of their changing activity patterns. And what's really striking from an occupational health perspective is that the largest increases, so you can see here, I'll try to, this is a bit busy, but it shows you the job types up here. This is the sort of legend for it at the bottom. So all the sort of oranges and greens are those jobs that are more amenable to telecommuting, and all these sort of blues and purples are the ones that, you know, less likely, and that you're probably going to have to go to a physical location to do your job. And you can see this is broken up by those categories of radon exposure. So this large increase at the bottom, and what you can probably notice is that I think this will highlight it. Yeah, that really it is lots of oranges and greens here. So lots of these workers in the bottom, that includes my job title, absolutely, probably many of us in the room. So that tends to be what drove the category of folks who had a more substantial increased radon since the pandemic started. So perhaps none of this is all that surprising given the crowd that I'm in, but really this is great to sort of have documented evidence that this is really a big occupational health problem. And I don't know that there's a lot of folks that have been talking about it so much. So as we move forward, this has really important implications for occupational health in terms of what's coming next for us. So here's our third poll question. So and you can base this on what I've said today, but this is just your opinion. What do you think the most important factor is? And I think all these factors are important. I'm curious what you think the most important factor is if we're developing policies for safely working at home, some or all of the time. So ergonomics, absolutely important. Is it indoor air quality in general? There's other social factors like isolation. Oh, sorry, I put isolation in there twice. That's fine. We'll double those ones up together. Ethical factors in blurring the boundary between work and private homes. So there are some ethical conversations about how much access does your boss get to you when you're at home? Or is there something else not listed here? I tried to come up with a few options here that might have resonance for you. Very interesting results coming in. Okay, thanks, Angela. So most of you, it looks like we have almost a tie between ergonomics and the other social factors. Super interesting. And then still, yeah, everybody picked something, just not that something else listed here. So I think all of these are going to be really important. And I think all of them have implications for those of us working in occupational health, whether that's in research or in practice and policy. And I think we'll have to consider all of them because I don't know that we're really going back to a pre-pandemic way of life in terms of work from home. So thank you so much for giving me those opinions. It's really helpful. So these are some published articles in the news from the last year or so. These are from Forbes. A lot of really excellent reporting on COVID and the sort of unintended consequences of COVID do come from financial magazines, which is really interesting. I never used to read The Economist before, and now they do a lot of great reporting. So these are some from Forbes jumping out just to say that telecommuting and a hybrid model of work is very likely here to stay. And I do think, this might sound a little bit like doom and gloom, but I actually think that there's a rare opportunity to reconceive our notion of work, what safe work is, what's a safe work environment. Our activity patterns have changed. That much is clear. And I think they'll probably continue to evolve as we move forward with kind of high background levels of COVID. But I think it's clear that we're not going back to a pre-pandemic state in anymore. And I think we can probably give up on that notion. But I think that that's just a call to action to work together across research practice and policy, labor organizations and employers to understand what are the implications of this new normal and how can we just make sure that we're not putting people at increased risk of other chronic diseases and just sort of making sure that we're not having a terrible impact on work-life balance as well, because that's another risk that comes up. I'm just going to do a teaser again for a couple of other ongoing and planned studies we have, which is great because I'm almost done and we'll have lots of time to chat. So I think this has really important implications in terms of what's coming next. I'm sharing here some unpublished data from my postdoc, mine and Aaron Godarzi's postdoc, Monica Caicedo-Roa. So this is, again, from the Evict Radon study. So Monica's study is about looking at the impact of people living with disability that either pre-existed COVID, or some people actually in our study do have long COVID as well. So some of them have COVID-caused disability, but there's a range of different disabilities in our study. And so we've managed to do that time activity pattern survey again and again. I know I shared some of that data before, but this shows a little bit more fulsome, but separating out by people who live with a disability or not. I find this graphic really fascinating. That there's a series that Monica kind of produced that I could have selected from, but I really like this one because it shows that before COVID started, we see, it's probably not surprising, people living with disability spending a little bit more time at home than those without. Not too much of a difference though. And then you start to see as COVID begins around here that there's a bigger difference. And, people are kind of trending back towards things that look a little bit more normal or more, pre-pandemic, but still this gap is persisting among people living with disability. And we've just collected this data again, so we'll be able to look at it for 2023 and see how these things are shifting. But I do think this is really fascinating that this seems to have widened the gap in terms of time spent at home for people living with disability. So it really does speak to a lot of the work that that Monica is leading for sure, that is really important to us at CareX Canada and Evict Radon. And so we're starting to think about, spending time at home can be great, but it can also increase your risk for a number of different health conditions, lung cancer included. And so we do really need to start to think about these marginalized workers. Lots of people who are working, who are living with disability do want to work from home more for perhaps obvious reasons. And so this is just a primary group that I really think will deserve more focus of research as we go forward. This is just a Radon Knowledge Series slide that I really like from Evict Radon. And this is, we do these kind of snapshots sort of showing the results of our research in little, snapshots, slides, or things you could share on social media. So this is about that study. So working from home increases how long you're exposed to your home's air to ensure you're safe. Test your home office for radon today. Please visit Evict Radon if you're interested in the work that we do there. And this is my last slide. I just want to acknowledge all the different folks that are in the Evict Radon National Study, all the different scholars, all the funders of it. Also want to acknowledge CareX, my CareX team, and the Canadian Partnership Against Cancer, who funds CareX and has done for a long time. And I will stop there and we can take some questions.